Welcome to our comprehensive guide on antiarrhythmic drugs. In this video, we will explore their classifications, mechanisms of action, and effects on cardiac electrophysiology. Here, we see a detailed diagram of the heart, highlighting the parts involved in impulse generation and transmission, such as the sinus node and AV node. This slide discusses the myocardial action potential in both automatic and non-automatic tissues, crucial for understanding cardiac function. The graph here explains the phases of myocardial action potential, detailing the ion movements during each phase. This slide covers the action potential in nodal tissues, comparing fast and slow channel action potentials and common electrophysiological terms. Here, we see a graph explaining the refractory period, highlighting the absolute and relative refractory periods. This diagram shows the depolarization and repolarization waves as seen in an ECG, essential for diagnosing arrhythmias. ECG is a vital tool for understanding cardiac tissue properties and mechanisms of cardiac arrhythmia, as shown in this slide. This slide discusses abnormal impulse conduction, including conduction blocks and re-entry phenomena, critical for arrhythmia management. Here, we see a detailed diagram of the heart showing counterclockwise right atrial reentry and passive activation of the left atrium. This slide lists the requirements for a re-entry circuit, including an anatomically defined circuit and a region of unidirectional block. Accessory tract pathways, such as those seen in Wolff-Parkinson-White syndrome, are explained in this slide with a detailed diagram. This slide discusses the initiation of supraventricular tachycardia in Wolff-Parkinson-White syndrome, featuring a heart diagram and an ECG graph. The regulation of heart function by autonomic tone, including parasympathetic and sympathetic stimulation, is detailed in this slide. This slide classifies NA channel blockers into Class 1A, IB, and IC, detailing their effects on action potential. Class 1 NA plus channel blockers, including Class 1A, IB, and IC, and their effects on ventricular action potential are explained here. This slide explains Class 1A drugs, such as quinidine, procainamide, and disopyramide, and their effects on action potential currents. Detailed information on quinidine, including its pharmacological effects, clinical pharmacokinetics, uses, and drug interactions, is provided here. Class 1B drugs, including lignocaine, phenytoin, and mexiletine, and their effects on action potential and adverse effects are discussed in this slide. This slide details Class 1C drugs, including encainide, flecainide, and propafenone, highlighting their minimal effect on repolarization and associated risks.